So we're going to be looking at membership, meeting rules, duties, and tools. And I'll start by saying that there is an update to the Welfare and Institution Code because of Proposition 1. And the changes need to take place by January 1st. So we're encouraging you to work on updating your bylaws and updating your membership and becoming familiar with the new requirements. So there's a document, there's a link to the update document at the top of this slide. And for those here in person, we put the document on top of your binders. The last page has these 3 requirement updates. You know, it's just a summary. But if you look through the whole document, you'll see in bold where the Welfare and Institution Code changed. So mostly the changes are from mental health to behavioral health, and including substance use disorder within your duties and membership. There are additional requirements for membership, including you must have a youth member who is 25 years of age or younger, who is either a consumer or a family member of a person who has received services for behavioral health. So either mental health or substance use services. They could have received services in the past or presently. So that's what a consumer is somebody with lived experience. Then also there's a requirement for a local education agency staff person. And that can be anybody that works for a local education agency. Could be a teacher, could be a counselor, could be somebody that runs a wellness center at the school. Could be the principal, or could be the superintendent, but it has to be somebody that is a staff member at a local education agency. Okay, there's a question in the room. We're getting the mic over there.
When we talk about local educate, Christine Hottie in Napa County, when we talk about local education agency, are we talking only about public schools, or would that include private schools that are in your county?
Good question, because it is lowercase in code. I'm hesitant to say. I think most of the conversation around this item that I've heard has been that it would be public, but it's a good question. I'm not sure. The code doesn't. The code is lowercase local education agency, so it's not. If it was uppercase, I'd say it's public, but right. Yeah. All right, so let's move to the next slide.
Oh, I have a quick question.
Yes. Go ahead.
You mentioned the changes with Prop 1. Could someone just put that link in the chat? Because I have the older best practices binder, and I went to the website and I wasn't really able to. It's been hard on the website.
Hard to find. Okay, yeah. And the materials are updated on our website under the training links. So, and I think I put, did I put in the chat the link to the documents for today? Yes, the materials, it's the third in the chat. All of the materials are posted on our chat here, so you can do that. And I can follow up with an email to you also afterwards to make sure you get this. The last reminder email that we sent out also had a link to the materials.
And I didn't get that link either.
You didn't get it? Okay. All right. Well, We'll keep working on it.
Okay, I keep having to sign in every time for every session.
All right, sorry.
I know, it's okay.
Okay.
I appreciate what I'm learning.
All right, so we're gonna go through membership, meeting rules and conduct, duties and tools, the Mental Health Services Act, and how to review and evaluate. And within each of these categories, we'll try to give you some resources or tools that you can consider using. All right, so membership. This is getting more and more complicated. We want these boards and commissions to really represent the clients served in your jurisdictions, in your counties and jurisdictions. And also want to have a large percentage of members who are people with lived experience or their family members. So the requirement is to have at least 50% consumers, and within that 50%, 20% must be consumers and 20% must be family members of consumers. Of that 50% consumers or family members, we must have one person who's 25 years of age or younger, starting January 1st.
No question.
Yes, another question. Oh. Our president's getting his exercise today.
My question is, are we close to this goal? Are we far away? Or how long will it take us to achieve this goal? Do we have to achieve it prior to January 1st? It needs to be done, or do we get a time in order to get this board compliant?
Right, so yeah, we're about 6 months out now, and this is the time. That's the time to make sure that you find a member to make yourself compliant by January 1st.
So are we compliant or close to it now? Where are we? What percentage are we?
So there are 59 boards and commissions, and we're doing the training, so they will do this. Yeah.
This is Steve McNally. Since Bill's here, I'm just going to ask the quick question. Since it's coming out of the families and peers section, will the local education person have to acknowledge that they're peer or family member?
So the local education agency is a different bullet. And they are not required to be a consumer or family member. They can be, so they can be part of that 50%. It's ideal if they are. It makes it easier for you to hit that 50%.
The first page. I thought the first page put them in the other category, but I'll double check. I'm sure you're right.
Yeah, this.
Oh,
this
it's a
first
youth
page is
person.
Second category.
So
for
well, the youth
local
person
education.
has to acknowledge that?
Right, it's the youth
Got it.
person.
And question, as I'm going over there, I had a question
Never-
too,
Okay.
because you don't get an extra seat also. It has to be within your board. So in San Diego, we have 22 board members. And it was brought to our attention that if we're full, we're going to have to replace someone with that youth. So we don't get an extra, we don't go up to 23 board members because of this.
Okay, yeah, every county is going to be different on your bylaws and how you set your requirements for membership. So most of the boards and commissions may not have a cap like that, where they have a certain number that's their maximum. But if you do have that in your bylaws, then you've set your rules, so you have to abide by them.
Yeah, and I'll double check our bylaw because I don't think we set it.
You don't have a microphone, I don't think.
Oh, sorry.
I was going to say, I'll double check our bylaws because I don't think we have a cap at 22. We just have 22 seats.
Okay,
Okay.
and 22 is too many, in my opinion, just so you all know, that's a lot of people. That's just my opinion.
Yeah.
All right,
Yes.
Cheryl?
Yes, Cheryl Hyman from Ventura, and I agree 22 is a lot, and we have 22 also, so
Wow.
it is a lot. My question is though, on the consumer and the family member, does the person have to be involved in the public health sector, or can it be someone who's receiving therapy or whatever privately?
It can be privately, as long as they've received services. Okay, thanks. Anybody else? Okay, let's, the next item on the list, where are we? Oh. Item 2, Board of Supervisor member. So somebody that is one of your, is on your Board of Supervisors, or if you're in a jurisdiction that doesn't have a Board of Supervisors, like Berkeley or Tri-Cities, then it's somebody from your local governing body. One employee from the local education agency, which we spoke about, one veteran or veteran advocate. And the definition of veteran advocate is really open. Somebody that advocates for veterans, it could be a family member of a veteran. So there is a requirement, if that is not full, that or if we have not filled that position on your board or commission, that the agency, your behavioral health agency, needs to reach out to the veterans agency locally and notify them so that you can fill that position. Yes, another question? Maybe we should have a couple of these microphones set up.
Yeah.
Sorry, I'm making you get your steps in. Carla Perez with Orange County. I just want to clarify. So for example, for like the veterans or like the local education board, do they have to have like there's the seat? Does it need to say that? So for example, let's just say it's like family member / veteran, or can it be fulfilled within? Because again, in our bylaws, we do have a cap of 15. So it's like
Okay.
playing Tetris, trying
Yeah.
to figure out how to, right? So
Right.
like one person may fulfill 2 or 3 different
Yeah,
roles.
that's fine.
Is that
Yeah,
okay? Okay, so I just
definitely.
wanted to clarify to make
Yeah.
sure that we're in compliance.
Right, yes.
I have, Carol DuPay, Orange County. I have a question about the youth. Uh, Does that individual have to be present in the room? And the reason I'm asking is because a lot of times youth are in school. And so would they be eligible to attend on Zoom? The rest of us have to be present in the room, but
Actually, you all have the ability to attend by Zoom if you put your address on that agenda and make it accessible to the public. So there may be ways for youth to make this easier, if even maybe it's their school that will allow them to use Zoom to connect to the meeting and have maybe a classroom or a conference room that's open to the public also that can join them in that room. So that way there's some other special circumstances, but this has been in law before the pandemic. That as long as you're posted, your address is posted, it's accessible to the public. You have to post the agenda outside your door, make sure that your address is on the agenda. And you can participate that way. The public needs to be able to participate with you. So you have to open your door to them. They can do public comment and participate in the meeting as well. If you're in Hawaii, it might be hard for them to do that, but you still need to post it outside your hotel room. So you might get some friendly guests from the hotel joining you. Is there another question?
I was walking it over to Bill, but now I've been told to leave it right here.
All right.
These two guys.
That's it.
We have 2 now.
All right, we need to control the room. Okay, so the next item, we put in capital letters, diversity. Reflect the diversity of the local client population. We know some of the boards do this well, and some of them don't. So we constantly want to, be considering ways to become diverse. We have a hand in the room. I think
Yeah.
this might be somebody that has suggestions.
Yes, I do have a suggestion. Christine Hatia from Napa County. I have found, what, it's hard. It's hard to find people who are interested in behavioral health and who represent diversity. But I believe it can be done with intentionality. For example, are there, in my community, there's a Hispanic Chamber of Commerce, in my community, there are organizations for Asian Americans and for LGBTQ and all these other groups that would represent diversity. And I've found that if you go to meetings of those groups and speak to them, you can find people, but it's a real intentional activity. It's not saying, oh, well, it's out on the county website that there's an opening. That is not what gets people to your board. It's personal interaction. So that's just my comment. Now, I'll bring it over to Denise.
One moment, we're getting the mic. Go ahead.
Hi, I'm Denise Elamine, and I'm actually in that diversity box. And I noticed, and I've been going to boards, trying to get on boards, and it's intentional not to put people on board of color. It's not an intent to get people of color on here. It's just not. If you want people of color, then you would have them, but you don't seek out. So that attitude needs to be changed. It's not, you guys are not trying to get people of color on the board for some, or maybe you want them to act a certain way. I don't know, but it's not intent. You need to change what you do.
The next item is individuals with experience and knowledge of the mental health system. And there's a listing of different representatives. And these aren't requirements, but it's just a listing of people and organizations where you would find people with knowledge of the mental health system, county offices of education, large and small businesses, hospitals, physicians that practice in emergency departments, police chiefs, county sheriffs, community and nonprofit service providers. And of course, this isn't comprehensive. There's a lot of sectors that intersect with behavioral health. And actually, this code will change to behavioral health. Right now, it's still showing that mental health. Another question in the room?
Yeah, are there any this is Harold Walk, Imperial County. Are there any penalties for the supervisors of the county if the supervisors do not appoint people in these categories? Because it's not on us board members to appoint, and we try, but we don't do the appointing. So I'm wondering if the state is actually doing the right thing and putting the pressure on the supervisors in the county to follow through with these requirements.
Right. Your question, it opens up both process as well as requirement. So requirement is, yes, they are required to have this, and they're required to appoint. But then if we talk process, and that's important for your board to roll up your sleeves and do, some of the suggestions that we've heard in the room. Christine mentioned, you have to be intentional. A lot of the counties have 30, 40 boards, but even if you're a small county, there are lots and lots of boards that the Board of Supervisors are appointing people to. This is a board that is different because we have these state requirements. And when the behavioral health director signs off on anything, almost anything, those federal or state agreements that they're signing off on for funding, they will ask, do you have a board? And if you don't have a board that meets these requirements, you don't have a board.
Okay, I go
Right?
back
So
to
we can write a letter together.
why
to your
didn't
Board
they
of
put
Supervisors.
penalties on the supervisors for not
Right.
doing the appointment? We only have a limited amount of authority.
Right, but you
the
need to encourage them.
well, I've done
And-
plenty.
Yeah,
But if the state doesn't impose penalties on the supervisors for making these appointments, it's futile.
right. Well, it puts your behavioral health director at a big disadvantage, and your county as well, if you don't meet these requirements, because they're signing off on these agreements saying that you do.
Again,
Yeah.
it doesn't help. Yeah.
Right, so.
Could I
that's
ask
why I say the second part of your question was process, and we'll talk about that more later too. You know, it's really important to have good processes to get people onto your board and commission.
Could I ask a quick question sort of related to that? Are they rejecting your candidates?
They're just not responding.
Okay, well, that's a rejection in a way.
That's a rejection.
Okay.
They're busy doing other things, Steve. And so, yeah, it's like,
Okay, I won't go into that. That's a longer discussion, but there are things to be done to put them on the spot. And maybe one thing would be we each give, make it easy for Teresa. We each give our name of our supervisor that sits on our board. And when we create it, she creates an e-list and she distributes and reminds people so that it gets from just another voice saying it. And the other is in this area, to her, I had a question about this too, is I don't think it helps too much to have people that haven't used the public system because we're the safety net. And it operates totally different than the private system. And that's my own opinion,
So we're
so.
getting a little off our train.
No, I just wanted to go back.
Pull the microphone from Steve. All right, thank you. All right, so, yeah, and before I move on to the next slide, I'll let you know, there have been times that I have partnered with counties to make sure that I, put the requirements either in an email or a letter and partner with them on making sure that the Board of Supervisors realize how important it is. And the staff appreciates that too. So, as Cal BHBC, we're just a nonprofit, but they'll listen when they see that we're using Welfare and Institution Code in our letter and telling them what the repercussions are if they don't meet these requirements. So I'm happy to follow up with you. And we can even bring in the, DHCS if we need to.
I'm just appalled that the state didn't do their job and impose penalties on supervisors if they didn't.
Yeah, with the Behavioral Health Services Act, in terms of repercussions, there is more built into that. So if they execute on what is in the new law, then they will actually not be receiving funding. All right, so Brown Act guide is our next item here. And we have a guide that goes through just the open meeting rules for California. During our last training, I think we went into this in a lot of detail. So I'm not gonna pull up slides for it this time. Just give you some basics and, make sure that people know that we have to have agendas. Those are set in advance, 72 hours in advance for regular meetings, 24 hours in advance for special meetings. And if it's a special meeting that's outside of your normal meeting times, then they need to, your board or commission, if there's local media that wants to be notified, they need to be notified if there's a special meeting. Yeah, there's another question.
I just have a question. You said yesterday that you guys, this governing board was a nonprofit and you didn't have to follow the Brown Act. What differentiates between nonprofits that have to follow the Brown Act and nonprofits that do not have to follow? How would I know the difference when I go on the website and look you up? How would I know?
There was just one occurrence, and it's been a few years since they were a nonprofit. There was a local board that had a nonprofit status. Most of the local boards, like Santa Barbara's Wellness Commission, you are appointed by the Board of Supervisors. You are under Welfare and Institution Code. required to be a Brown Act commission. And in San Francisco, they had set up, they wanted to be outside of their agency. They didn't want to be under the department for a long time. So they set up an actual 501c3 nonprofit. And they worked that way and had an executive director. But they were still, they abided by Welfare and Institution Code for their board. They had the Board of Supervisors appointing their members. So they were a nonprofit that's an example of a nonprofit that has to abide by the Brown Act.
So how do you know when you fill it out? Because I've been a part of the 501c3 that had to do the Brown Act, and I didn't know that there were, and then I feel like I take that back, because I just found out at the school that they're being made up a new.
Oh, do you have the mic?
Oh, no.
Yeah, and let's try to move on, because this
Yeah.
question's a little outside of our, it's outside of our,
Well, it's
normal.
just because I need to know, how can you, it's like, how do you come to ask to be a nonprofit, and then you to get to decide whether or not you want to follow the Brown Act or not? How is that possible?
so yeah, so public boards are the ones, the local public boards must follow the Brown Act. Nonprofits generally are not public boards. They're generally, they have, the nonprofits usually have to file their bylaws with the state. So they're outside of what we're training on today.
So you guys, because you're in San Francisco,
No, we're not in San Francisco.
I mean, Sacramento, is that the reason why you don't have to?
We are a statewide nonprofit. We're not appointed by
You're not
anybody.
governmental. Oh,
Yeah.
Public versus private.
oh, okay, so you guys are public.
We're private, nonprofit.
Okay.
Thank
And
you.
Teresa, I just wanted to add also that in San Francisco, even though we do have to abide by the Brown Act, San Francisco also has sunshine ordinance that we have to adhere to.
I know, you guys have so much fun. All right, so I'm going to move on from the Brown Act unless there's some questions around it. Okay, well, before I move on, I just want to say, it's there for the public. We want the public to be part of your meetings, and you are there for the public. You're a tool for the public to be able to speak to the local agency and to the Board of Supervisors, and to raise the issues that you should be wanting to listen to. So, that's why the Brown Act is in place. We have a slide here about conduct. So go through this. Active listening to me means listen, and listen. It doesn't mean respond. It means just listen. Let people talk and try to be really attentive to what they're saying, whether it's one of your board or commission members or a member of the public or a speaker or a staff member. Try to really listen to them, whether you agree with them or not. And know that you will be meeting again and again and again. You're going to have a lot of meetings and a lot of ways to act on information that you learn about. And you will need to prioritize information too. We can't act on everything that we hear. So just try to be a good listener, and then consider what you can do at another time. Try not to act immediately during a meeting unless it was on the agenda. Go ahead.
So I just want to make sure I'm clear. Is conduct the same for nonprofits that follow the Brown Act and that don't follow it? Is conduct across the board?
So these are best practices. This
Yes,
is
best,
not
these are
law.
not, these are not law. These are just,
This is
okay.
best practices.
Like being kind and polite.
All right. So we're gonna, number 2 is focus on issues. We don't want anybody focusing on like people. We want people to focus on what are the issues that we can make a change to. And when I say issues, I compare them to problems. A problem is something that's so big, you can't just go after it and solve it directly. But you can break it down into issues. So like homelessness is a problem, right? We can't just solve it. Can't throw money at it. We can't yell at the politicians about it. That's not gonna solve it. But we can break it down and say, okay, we have people that have behavioral health needs, and when they're exiting hospitalization, we're seeing them fall back into hospitalization again, or we're seeing them fall into homelessness. What kind of remedy do we need there? So we've identified an area where we could say, okay, something that we've done in the past is we've identified boarding cares. We know that that's a need that some people still, when they come out of hospitalization, they need 24/7 care for whatever reason, and they need housing. And we know that there weren't enough boarding cares in our community. So that is an issue, and we could, create an issue paper on it if we want to. We could do some research meetings, both within our behavioral health agency and with outside community nonprofits and leaders, just to understand that issue better in our community. And then we could even create an issue paper to make recommendations with, and use that in order to guide us as an advisory committee. So issues are really what you're looking for. And then we'll talk more about how to move and make action on those. Number 3 is person first language. So we talk about people, person first means, a person with mental illness, or an individual with bipolar, or somebody with substance use issues or a substance use condition. We never say things like the schizophrenic or the addict, because people are much, much more than one thing. We have lots and lots of things that are that make us up. And there's a lot of intersectionality between, just lots of things that make up a person. So try to do person first language. No swearing if possible. There are some people that I've met that's been part of their vocabulary throughout their lives, but try not to swear. No personal attacks or criticism of yourself or others. Try never to get personal, and that helps you with number 2 or number 1. If you are doing that active listening, you're just listening for issues. So 1 and 2, listen for issues, whether or not you like that person, whether or not you agree with what they're saying. Just focus on listening for issues and find ways to work on issues. And if that is not a priority that they're talking about, that was not something that you might want to be considering for the future for working on issues. Keep comments short if possible. Do not monopolize. Limit acronyms. So just about everything needs to be spelled out. You'll have new members coming on your boards and commissions who won't even know what the Mental Health Services Act or the Behavioral Health Services Act is. So MHSA and BHSA, those will be new terms. Yeah, there's a question, Katie? No? Okay. All right, and then silence your cell phones if possible. We know some people, they need to be checking their cell phones, but it is distracting. And when we talk about trying to be open in terms of ethnicity, race, and culture, that's an area where we see problems sometimes, where might be either a board member or a speaker or staff member that has a heavy accent. And I've been in meetings in different counties where I look around the room, and when that person starts talking, I see people looking down at their phones. So that would be the wrong time to be staring at your phone. That would be the time to go back to number 1 and really, really listen. You want to hear what people say. And it's not the time to check out when somebody has a heavy accent. Let's see here. Yeah, another question.
Hi, Carol DuPay. I was just going to say, I have this great definition for active listening. It is listen to understand versus listening while waiting to respond.
That's good.
Yeah, isn't that great? I like
Yeah.
that too. Yeah.
This might come up later, so, but I just want to put it on the table. All those things are terrific, but it also screams out to me that we really need to use parliamentary procedures at our meetings. And all board members are familiar with how to do
Yeah.
that, because that will move it
order.
along. That'll get stuff tabled for future use by committees.
All right, so we're going to go through the duties now. And this is in Welfare and Institution Code. What you see at the top of the slide is some of the code. And then the rest of the slide is some suggestions for tools. So the first one is to review and evaluate the community's public mental health needs, services, facilities, and special problems in any facility within the county. And right now, the code says where mental health evaluations or services are being provided, but it's changing to behavioral health. So the tools that we suggest would be speakers, panels, community forums, bringing in community organizations and agencies and your agency, your own mental or behavioral health agency staff. It's great to have panels, especially because you can bring people in from all the different entities that may be working on a certain issue. So if you say had speakers on children and youth, you could bring in both staff from your behavioral health agency, staff from maybe your county office of education, or maybe some of your schools staff, wellness center staff from a school, could be a nonprofit that serves children and youth locally, that might be a contractor of your behavioral health agency. Get them all at the table, and that way they're accountable to each other when they talk. And they also, it breaks down silos for them. It gets them in conversation, and it helps you understand the barriers and challenges better, as well as the successes. So it'll help you advise. The second tool is liaisons to others, commissions and committees. So if you've identified priority issues that your board is interested in, and maybe one of your issues is housing, you might want to have one of your members attend like the local housing committee meetings or housing commission. Site visits. Again, if you've identified certain sites that either you've heard from the public that they are concerned about a site, that might be one that you choose for your site visit. It could be that there are specific areas you're focusing on. Maybe, again, like maybe it was children and youth, you would go to a facility where your county is placing children and youth, or go to a program and like a wellness center at a school and do a site visit there. Ad hoc committees. So those can be helpful. An ad hoc committee doesn't have to abide by the Brown Act. Well, you always have to abide by the Brown Act, but an ad hoc doesn't have to abide by Brown Act rules if it's less than a quorum and it's short-term subject matter. So usually it's 2 or 3 people that will get together and work on a specific topic or challenge, or maybe it's just putting together an annual report or updating your bylaws. All right, then performance outcome data is another way. And CalVHBC has put the data that we could find from each county on our website. We have a tab at the top of our website called performance, and you can look at your county And that's something to review when you're looking at the what will be the Behavioral Health Services Act plans. The counties are now required to put that performance outcome data within the plans. So you can review any county agreement entered into pursuant to section 5650. So section 5650 points to a lot of the different agreements that the county has with the state in order to provide services and receive funding. So the counties have hundreds of agreements, and we don't want you to be sitting staring at agreements. But there are times that it is, you know, it's good to either be asking some questions about the agreements or getting presentations. So staff presentations and reports are a good way to look at like some of the larger, there's something called a performance agreement between the county and the state. So just getting reports on Medi-Cal. You know, once a year, the state will do an annual audit, and taking a look at the recommendations within that audit and the performance improvement plan section of the report. It's a really long report, so I'm just kind of pulling out what would be useful for you to look at. So the recommendation section, performance improvement plans, and we have a link for each county. So you can take a look at your most recent report. And then Mental Health Services Act plans and updates. And the SAMHSA grants, I think that's Substance and Mental Health Services Administration. There are some major grants that most of the counties are applying for there as well. And there's a lot of requirements within that to provide information on performance and who's receiving the funding. So a lot of times presentations on those can be really helpful. So when there is a new request for proposal or request for applications and the county is looking for new contractors for a service, and it's a major new contractor, that's a good time for you to have board members involved and just reach out to the staff and ask to be part of the process. So you can have members, you know, reviewing the applications, being part of the interview panels. That's a way to be involved with those. And then site visits. It's good to be able to review the contract before the visit, especially the deliverables section. So you can see what is expected from that contractor. Yeah, another. Oh, you got one.
Oh, thanks. Okay. Cheryl Heitman Ventura. So we have had sort of a discussion going on when to see those contracts. And you're right, there's a lot of them all the time that are being approved, but does the board usually weigh in before the contract goes to the Board of Supervisors, or do we just see it after it's already gone?
Right, I would encourage you to try to be part of the process before that it goes to the Board of Supervisors. You know, by the time it gets there, they're just signing off on it, right? So if you can connect with the behavioral health director and ask to be part of the process, and see if you have a couple of board members, you know, one or two that want to be like part of the interview panels, part of reviewing the applications. That I think they need that kind of input from you all. All right. Duty number 3 is advise the Board of Supervisors and the local mental health director, that's going to change to behavioral health director, regarding any aspect of the local mental health program, which will be the behavioral health program. So we have some suggestions for advising. First, identify what you want to advise about. You know, be listening during public comment, when you're reviewing performance outcome data, or receiving presentations, or listening to, you know, just some updates from people on your board that might be liaisons to other committees or commissions. That's, you know, through listening, identify an area where you think you need to make a recommendation. Once you've identified that, then you do some research. So ad hocs are a good tool to do research. And I like research meetings where you have a couple members of your board that, you know, together they will, you know, set up some meetings with maybe the behavioral health agency staff, get an idea of who they should be talking to on the issue within the agency, and then, you know, maybe among the contractors as well, or outside of the agency. Then we mentioned here that it's actually in Welfare and Institution Code that the chair should meet regularly with the mental health director. So that would be, you know, a part of research as well, is that the mental health director can be really collaborative sometimes with the chair and with the board. And if they are meeting regularly, that can be a way to help both the agency and the board in terms of what their interests are. And it's great to be on the same page, because you know that the Board of Supervisors is going to go directly to the Behavioral Health Agency director usually with their questions or their concerns. So it's really important to be in really solid communication with that director. And the chair can, you know, mention to the director if there's certain specific ad hocs that the board has decided to do, you know, they can be given, you know, better contacts that way within the agency. And then site visits, yeah, question? Oh,
Harriet Stevens, hi. We have, do have monthly meetings with our director, but because we have so many new commission members and new co-chairs, do you have any suggestions for what we could have as an agenda for those meetings? Because this is the first time I've heard, although I was the chair also and met with the director, but I think the director at that time was more familiar with the work of the commission, and so the agendas were pretty much established. But I'm wondering how we can support the new people in meeting with the new director.
okay, I'm going to come back to you on that. And actually, I had an email from San Francisco from your chair yesterday. So let me follow up with you on that, okay?
Terrific. Okay, thank you.
Okay. All right, and then site visits are a good way to research things. You know, sometimes you will hear during a meeting, maybe it's public comment, where somebody's very concerned about a site. And sometimes it's appropriate for you to say, okay, well, why don't we do a site visit? But sometimes if it needs to be addressed right away, that's another chance either like for the chair to talk to the behavioral health director, or sometimes the behavioral health director will just say during that meeting, our staff will follow up. But you want some of these issues sometimes to be immediately dealt with by the staff. And it's not your board, you know, you're an advisory board, but the staff, they need to react quickly sometimes to things that they might hear during your meetings. And they have the ability to do surprise visits at the sites of their contractors and decide, you know, is this a contractor that we want to keep? Yes, JD.
Question. My name is JD Hatch. I'm the chair for Solano County. Can we have people come to the board meeting and do a presentation instead of going to the sites? Because there might be a whole bunch of sites to go to. So if I'm having a problem with one of the sites
Yeah,
or something, can I let my director know, hey, can we bring this person in or this agency in and do a
yeah,
presentation for us? If I see something wrong or somebody else sees something wrong, is that okay to do?
yeah, definitely. Yeah, it's good to, and it could be whether, it might be that there's something wrong and you want to bring in some speakers to tell you, sometimes you want to ask them questions like, tell us about your barriers and challenges. You don't want to attack your speakers.
But
It's not usually constructive, but
okay, but it's just to avoid going to the sites. Cause there
Yeah.
might be a lot of sites to go to, might be
And some-
100 sites
yeah.
or whatever, so it's easier to bring them to.
right, sometimes it is easier, like, there will be, sometimes some interaction between the jails. And it's difficult, I mean, some of the boards do actually do site visits at the jails.
Yep.
But it is difficult, so it's easier to invite the warden to your meeting. But at the same time, invite the behavioral health staff that interacts with the jail. So you can get their perspective on the programs that your agency works with the jail on,
Okay.
that kind of thing.
Thank you.
Yeah, yeah, but yeah, speakers are a good way. Yeah, to just bring them into your meeting and learn more about a program that way. And sometimes it's a successful program, you want to know what the successes are so that you can make recommendations for more.
Right, because it's a
We
whole,
need to scale it throughout our county if it's a good thing.
right, because I know every county's contracted with, with a whole bunch of different agencies and to go out and visit a whole bunch of sites, is, like I said, that's time consuming to me.
Right,
And it's just easier if we could just have a conversation and bring them to, my place and hey,
right,
and have that discussion.
right, yeah, could be. Oh, Harriet, go ahead. Or maybe you're.
I just need to take my hand down. That's fine.
Okay, all right. Denise?
you.
I want to talk about the site visits because a site visit is what it says, site. I've been in a lot of meetings and supervisor meetings when the vendor comes and everything is 100. But when you go to the site and you actually see with your eyes, you notice that it's not 100. So that's why they encourage you to go so you can see versus them coming telling you everything is okay. I listened to the police tell me that jail, they do treat the people so good there. I told them the last time at the meeting, I said, I feel like I should have vacation in jail the way you treat people. So you can't go 100% by what people tell you. You need to actually see it.
And yeah, I would say it's a combination, bring in presenters, do site visits.
One thing we've done is we want to do more site visits. So we've sort of tried to divide the board into groups of 3s and 4s. So the site visit has become a Brown Act group of 7 or more, whatever. And that way we can cover everything. And we picked up a form from another county that we adapted, the one in
Good.
Riverside. And then we can get more accomplished, at least getting the information. We haven't quite yet got a way to move forward as far as, people responding, getting things done, but we're moving and that's good.
Yeah. Okay, and then the third recommendation is to advise. So you've done all of this work, you've identified, you've done your research, and then you're ready to make a recommendation. So maybe your ad hoc is going to draft a recommendation, maybe your executive committee would draft a recommendation, and then during a meeting, vote on that recommendation. And then, notify the behavioral health director, notify the board of supervisors if that's appropriate, and make your recommendation. If it's voted on, it's considered a substantive recommendation. If it has to do with services that are provided through the Behavioral Health Services Act. And then the staff either needs to implement what your recommendation is in the next plan that they're drafting, or they need to explain to the Board of Supervisors and the California Department of Healthcare Services why they didn't implement your recommendation. Okay. Next item is review and approve the procedures used to ensure citizen and professional involvement. So we put that in big letters, ensure citizen and professional involvement. And we underlined it's approve the procedures. So you are supposed to be looking at what kind of procedures has the staff identified in order to reach out to the public as they plan. You know, they want the public's input in order to plan for their behavioral health offerings. And it's your job to ensure that that's happening. So do that by having meetings yourself, you know, publicize, let the community know that you have your meetings. So your meetings are an important part of this. Encourage public comment, make your meetings accessible in terms of location and times. And I really appreciate it for the boards that provide a Zoom option, because you know, neither me or CalPE HBC staff can attend your meetings, and we can learn what's happening locally. And it's good for your populations too. Even small counties, a lot of times are huge land masses, so it's very difficult to get to a meeting, but people can connect easily on Zoom. Tools. So you should be receiving staff presentations regarding the planning process. Review the staff reports and updates regarding the what will be the behavioral health services community program planning, and also look at cultural plans and performance improvement plans. Attend some of the public events. If it's open to the public, your board and commission members can attend. And then also you could be liaisons to some of the internal committees that the staff runs, like the cultural committees, quality improvement committees. SALTS is specific to LA County. They have service area leadership teams. And then review adopted mental health plans, Mental Health Services Act plans, and updates, and cultural plans and updates, and make recommendations to ensure that the plans address the needs of the community. And then we have a couple of resources with links here. So the Mental Health Services Act community program planning requirements are in our best practices document. For those that are in the room, we have the binder with that information. And then also we have cultural requirements within the best practices document, page 11. Duty number 5, submit an annual report. How many people in the room have done their annual report recently in the last year? Good, that's good. And we like it if you send us your annual report. Harriet, I see your hand.
Yes, we've done a recent annual report, but we're a year behind.
Well,
So-
at least you did.
We did the
And you're-
22-23,
I did it here too.
and you'll be getting a copy of the link to the report.
All right, good. Yeah, we like to review those and put those on our website.
Right.
All right, thanks. So remember, when you're doing the annual report, it doesn't need to be a long report. It just needs to include the needs and the performance of the system. You know, a lot of times it's good to just provide some information about who your members are, what areas you have maybe prioritized for making recommendations. If you have made recommendations, what they are, maybe put that on the first page, because that may be the only page that the Board of Supervisors will look at. It doesn't need to be long. It could be brief, but really focus on needs and performance and what you recommend.
Well, in as you mentioned, San Francisco is a challenge because we have a compliance office as part of the Department of Behavioral Health Services. And so each year we have to also respond to what they've identified as what our objectives were going to be, like how many site visits, presentations, resolutions, as well as, you know, the regular work that we do. So we keep it about 10 pages.
Okay. Yeah, I think about 10 pages is what I see as average. Although I've seen just one page, it was a small county, Mono County, and at least they did it, you know? So it was fine. Duty number 6 is review and make recommendations on applicants for the appointment of a local mental health director. So, it's good to take this code and show that to the Health and Human Services Director. If there is an opening, make sure that they're aware of it. It's not like they know this. They need to be reminded. The administrative liaison a lot of times can be helpful in making sure that staff knows that your board should be part of this process. Just like we recommend, like for new contracts, you could have maybe 1 or 2 of your board members participate in this process. So be part of reviewing the job description. And we put in our frequently asked questions on our website, information from the state welfare and institution code on some of the requirements for a behavioral health director. So that's good to be familiar with what are the requirements the state has for that director. They're going to be probably appointed by the Board of Supervisors into that position. But they want, they want to have a robust process for hiring them. So be part of reviewing the applications and participating on the interview panels. And then duty number 7 is to review and comment on the county's performance outcome data and communicate findings to the California Behavioral Health Planning Council. And so once a year, the Planning Council will provide a survey that's called a data notebook, and it will have questions in it for you to answer. In recent years, we haven't seen much for performance in there, but we're hoping that maybe there will be more. This year, they're actually asking the counties to let them know what performance measures you're interested in commenting on. So maybe that's progress. So we'll get input on what we would like to have the counties be required to provide in terms of performance information, because we're kind of shifting toward just anybody was reporting anything they felt like over the last several years. And every county was different on what kind of performance information there was. And now we're starting to get to the point with Proposition 1 where it will be standardized. There will be requirements for what the counties will be reporting on. But we're going through a process now. It's just deciding what will those measures be. So we have a link here to CalBHBC's issue brief on performance outcome data, and then also a compilation of performance. So we have a tab on our website for performance, and we have every county listed, and you can just select your county and take a look to see what we have just compiled from what we've looked at in your reports. And then the 5 categories here, actually there are 6 categories now that we've updated our performance outcome issue brief to include. So there's children and youth, where you'll see information oftentimes about attendance at school. If, these are children that have been provided services, behavioral health services through a program. And so there'll be grades maybe as a measure. There might be some like just assessments, behavioral health types of assessments that have been done, both at the beginning before the services started and then maybe 6 months in or a year in. So you can see if there has been progress toward wellness. There's self-reported wellness. The parents sometimes will see data for if the parents are reporting improved behavioral wellness, and teachers as well. And then there's criminal justice. Performance around that would be reduction in arrests, reduction in incarceration. In some of the counties, they're reporting 100% improvement, you know, so people are not being arrested or incarcerated once they get into the programs, which is, you know, that's why we're here. You know, that's not the way to access your mental health services or behavioral health services. Employment. So we might see information on people that are either getting like certificates or education toward career goals, or people that are employed and that they're maybe in sustained employment for maybe 6 months or more, which is good. And then hospitalization, there's data on rehospitalization, and it depends on the reports. MHSA, some of the counties are reporting on rehospitalization. And again, just like with incarceration, sometimes you see 100% improvement where you see nobody being rehospitalized once they get into the programs. And then housing. And we see huge improvements there as well in some of the counties in terms of folks just staying stably housed with the programs that they have. So they're usually in supported housing if they're still connected with the behavioral health agency.
A question.
Yeah.
Since substance use disorders is now going to be part of behavioral health, will those performance outcome measures also will that be another bucket is what I'm wondering.
Yeah, that probably will be another bucket just by itself. Yeah, we only have a few counties right now that are just, you know, reporting on that individually. But yes, I think you have a good point. Yeah. Okay, you can have additional duties. Sometimes the Board of Supervisors might decide that your board or commission is the right place to ask for more. So I've seen that happen in Yolo County before when the Board of Supervisors asked them to oversee the Public Guardian's office. Assess the impact of realignment of services from the state to the county. And so we've had realignment happen twice in 1991 and in 2011. And both times, you know, there were changes that affected behavioral health services and other sectors that intersected with behavioral health. So both funding and responsibilities moved from the state level to the county level in those at those times. And we still, you know, have issues, of course, with not having maybe the right funding allocated to behavioral health. There are multiple agencies that will work together with this realignment funding. So it's good to just maybe get the reports from your behavioral health director in terms of, you know, how the realignment funding is working. And realignment, you know, if you have a board that does have members from multiple sectors in the community, that can be helpful too, because the more they understand how behavioral health can impact arrests or incarceration, it can change the way their budget works over time so that we're putting money into prevention, intervention, and behavioral health instead of into incarceration. All right, with the mental health, with what will be the Behavioral Health Services Act, the role of your board is, the three things that we call out here, and again, this is in our best practices handbook, is first to assure citizen professional involvement. We should have family members and people with lived experience as part of the process. We should have people that are unserved and underserved as part of the process, which is key. And requires a lot of intentional planning by the department and going outside of their normal circles in order to find the organizations that would have people that are unserved or underserved, or help them get to those communities that we can see, you know, statistically aren't receiving services but should be. So we have a one-page document that just goes into the definition of community program planning and the requirements for who the participants are and the requirements for the staff in terms of all of the different pieces that they need to put into place in order to make sure it's a good process. So the next role you have in terms of the MHSA is just to review and advise, just like with everything else. So vote on your substantive recommendations. And again, we put on this slide that a response is required by the staff. And that response should either show that they've incorporated the recommendations into the next draft plan or update. And if they haven't, then they need to summarize your recommendation and analyze it and provide information to the Board of Supervisors and the Department of Healthcare Services for why they didn't implement your recommendation. And then, and I want to back up just a little bit, because sometimes the boards and commissions get confused on this. They think that they should be making their recommendation on the draft plan, but it's not the draft plan, it's the adopted plan that you make your recommendations on. So once it's been signed off on and it's called adopted. Once the Board of Supervisors has signed off on it, then it's adopted. So it's at that point that you start considering your recommendations for the next round. So you have, you know, several months to be making your recommendations, not 30 days. During that 30-day period, the staff is trying to finalize it, and they will put the comments from the public and your comments as well within that document. But it's difficult for them to move on it at that point because they need to get it signed. So it will carry forward into the next year, and kind of you can look through the comments, and that can help you in terms of making your recommendations moving forward. Yeah.
Do you know how that will be, sorry, Carla Perez with Orange County. Do you know how that will be affected now with the BHSA? I'm under the impression that there's gonna be, that you won't need a public hearing every year now. It's gonna be every 3 years. Is that correct?
It looks like it's every 3 years. I need to look at it more closely too. It looks like, right, the public hearing may be every 3 years, but I think there's still a requirement for every year that there's
is
an
an annual.
update.
Yeah.
So, right.
So I'm just wondering how that will affect the advisement and how it'll affect the boards and what the rules, I'm sorry, what the role of the boards will be,
Right.
right? And so, I mean, that would be something to take a look at and for all of us to just kind of be in the loop of that moving forward,
Right,
just so that we make sure we follow the correct moving into the BHSA.
That's a good point. I'll make a note to myself too. I want to make sure I inform you correctly. I think
you.
that it will be every year that you can still make your recommendations. But I'll make sure that that's the case.
So I think it would be the same with the recommendations, just the only difference would be maybe just the public hearing every 3 years.
Right.
Okay.
But the program planning process will just continue constantly anyway.
Yeah.
But yeah, the hearing I think is every 3 years. Okay. And then this last slide, I think this is the last one. Yeah, review and evaluate. So we just put some suggestions to help you. We realize that, you know, we've talked about how intentional we need to be in terms of having a lot of people with lived experience and family members and people that intersect with the behavioral health services, either in their professional lives or in the community. So the makeup of the boards and commissions themselves put people in a position where their opinions and their experience and backgrounds really inform them and that's why they're there. We want those people to inform the system. We want the user's perspective, the community's perspective, the family member's perspective on whatever services or programs or anything that the offerings are providing. But at the same time, so you're experts on your own experience, so remember that. But we went ahead and put together some suggestions for things to think about when you're evaluating. One is accessibility. Is the program culturally relevant? Is it scaled to fit the needs of the community? Is it integrated? And is it communicated? Do people know about it? How's the signage? Can you see it when you drive up? Is it easy to get to? Or is it communicated to the community, like through social media, the internet, radio, TV? How do people know that you have services? And then 2 recommended practices. So is it client and family driven? Are there peer providers? Clients and family members, are they treated with dignity and respect and included in decision making? And program leadership and staff, does that include people that have lived experience and family members? Those are good questions to be asking. And then evidence-based practices, are those used, or trauma-informed practices, or what's called community defined evidence practices, which are practices that I think culturally we've learned are helpful. And then sustainability, are the programs financially viable, or are these nonprofits crying out saying, we're going to close because of this funding? It's not adequate. We can't, workforce is dwindling, but asking those questions and making recommendations so that we can make sure that the programs we want can stay alive. And then 4 would be performance. Okay, and then actually there is one slide here that just points to a lot of the resources, and I've mentioned some of these during the training this morning. So you're always welcome to come back to this presentation. It's on our training webpage, but also our website set up with a resources tab. If you just go to that, you can select your resources from the resources page, or go to the trainings page to get the trainings. And then we also have a news and issues page, which has over 30 different pages of issues, just from older adults to criminal justice to courts. Just there's so many different issues related to behavioral health. So I will stop there. Is there any questions? Yeah.
Probably everybody knows the answer to this except me. What's the difference between a board and a commission?
I think it's just name.
Oh,
Been
really?
doing this for a while. Yeah, in other states, instead of the board, yeah, in other states, instead of board of supervisors, they might have county commissioners. So the word commissioner in a different state means something different. But here in California, I think, you know, it's just kind of up to the county what they want to call it.
Huh, it's just, so it's no big deal. It doesn't have anything to do with anything except whatever somebody wants it to be.
Right.